If you need to treat yourself, you just use medical self. So for the minute, let's just click on medical. So you guys don't have any supplies, but I'll just go over a brief overview of what actually all this entails. If you're treating somebody else, up in the top left you'll see their name, so that's an easy, quick way to verify who you're actually treating or intending to treat. In the center you'll see a body. That is basically where all the damage will be represented on the person. So you can click their head, their torso, their arms, and their legs, and you'll see in the overview on the right hand side that each of those body parts as you select them changes. And once you select that, it'll tell you what damage has been done to that area of the body. As somebody has just done for Twigster, right below the body is a triage status card. You can select minor, delayed, immediate, deceased, etc. and so forth. That's a quick, easy way to identify patients by priority. With CMS properly integrated, which it's not on this server because it's not a standalone server, it's a client-run server, their triage status will be floating above their head. So if they're immediate, then there'll be a red immediate thing above their head, or their name will change to red. The examination card on the left-hand side of the body, that'll just show you what you've done to the patient. So you administered 2 times morphine, 3x large bandage, etc. and so forth. It's an itemized list of what's been performed or what's been given to the patient. Activity log is available for all to see in real time. It records 8 entries, so only the last 8 entries that are done are viewed. Quick view shows you basically what sort of status indicators and the same thing. So if you close it, the quick view will be reset. Up on the top of your triage card, you have selectable toggle buttons. So view triage card, examine patient, bandage fractures, medication, blah, 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 blah. That is how you interact with the patient as far as administering medication and checking their status. First thing you're usually going to do to check a patient is click examine patient and check their pulse and blood pressure. If they're unconscious, you can also check their response. If they're unconscious, there's a couple different scenarios that you can receive when you check their response. You can see that they're lucid, or that they're slightly responsive, or they're completely unresponsive, or something like that. Those don't work 100% of the time. They're working on fixing that, so that's just one thing to... You can do it, but it's kind of pointless at the minute. Pulse and blood pressure are the most important. Can anybody tell me what a normal heart rate is? Like a range of what a normal heart rate's supposed to be?
80. Oh, 80 to 90.
80 is normal for CMS. The good range for a pulse that you want to see is anything from 60 to 90. Anything below 60 is concerning. Obviously, in the real world, I mean, I'm not a relatively fit person, but I have a resting heart rate of 62. So I have a relatively low resting heart rate, which is normal for some people. So just for CMS, the standard blood pressure that you tend to see a lot is 80. With CMS integrated, if people have been running a lot, their heart rate will be elevated. It does simulate that. So anything from medication to strenuous activity will raise the heart rate. Blood pressure. Yes, Peter.
He's stuck.
Where is he?
Oh, you need to sit down. You need to press the sit down button. That will fix. Press sit down, and then you can stand up again.
Yeah, don't try to carry people. It's broken at the moment. I don't know why it is, but I'm working with some of the CMS guys to figure it out. So.
The drag's also broken.
Usually works when you have a gun, though. For some reason.
It worked for me earlier.
Yeah, I don't know. Drag carry is sometimes goofy. It works on our MilSim server, but I don't know. It's a goofy integration. Anyway, blood pressure. Recent changes as early as, I believe it was 2012, the regulation was changed for the different what's normal for blood pressure. It used to be 125 over 90. Now they went back to 120 over 80. So you'll find this game very representative. The representation that you'll see in blood pressure is systolic over diastolic. That's basically the pumping versus the flowing pressure. That's why when you get your blood pressure taken, they pump the arm cuff all the way up until you feel like they're going to chop your arm off because you can't feel it. And then they listen for heart rates at key points. They listen for when the heart rate starts and when the heart rate stops. And then that tells them what your blood pressure is, the high and the low range. So 120/80 is normal. If you see 120 over palp, which is 120 over 0, then, or if you have a palpable flow, you'll say 120 over palp. But you guys can't, obviously you can't palpate, so 120 over 0 is bad. That means there's no return blood flow. 0 over something you will never see, because that means basically they have no blood pressure, so there's no flow, there's no return. Other than that, if you see a high blood pressure, there's certain medications you can give. If you see low blood pressure, there's also certain medications you can give. So I'll get to that in a minute. Any questions about the CMS interface whatsoever?
When I hit view triage card, what is it supposed to show?
Okay, for example, let's say I'm just going to grab, okay, this won't kill me. I'm going to self-administer a Surette or an or a handy pen of atropine to myself. So on the triage card, oh, it doesn't show atropine. Okay, never mind. I'll show it to you guys later when we shoot up dummies and blah blah blah. So.
Oh, I can see it, by the way.
Oh, you can see it?
Yeah.
Okay, yeah, it shows an itemized list of what's been given to the patient. I guess I just can't see it if I do it on myself.
Yeah, I can see it too.
Yeah. It gives you an itemized list. It just tells you what's been used, bandages, medications, if you've administered any type of fluids. So,
Okay,
and now my
thanks.
heart rate's jacked up, so what did I do? Anytime you have, everybody's checking my BP.
I have one.
Okay, my heart rate's low
60.
by a little bit, but I'll just give myself some epi to make it stop as opposed to running around. If your heart rate goes below 60, or did it just stop? Oh, it's coming back naturally. Okay, I don't have to do shit. If your heart rate goes below 60 or above 120, you will hear a heartbeat in your head. So if you have a patient that says, I can hear my heartbeat, that usually means they have a pulse or blood pressure problem, so that would be obviously the first thing to check. Outwards, you won't get any outward signs, and you won't hear it outside the patient. They can only hear it inside their head. I just want to make sure I don't pass out. That would be really funny. Okay, my heart rate's normalizing. That works. Alright, so everybody find a box. We're going to talk about some of the medical supplies. A lot of this stuff you'll see is pretty standard. When we go to, in the real life, when an EMT goes to a scene, they're usually given anywhere from a lot of information to almost no information about the patient, depending on what the dispatcher was able to get, or the 911 dispatcher was able to get out of the caller. I've shown up to guys who have had heart attacks and are in VFib, where I get a call that they just said, oh, he's passed out on the floor, and we don't respond as fast as we should because that's the information we get. In this case, what you guys will have to do is basically assess once you arrive at the scene. If you know it's a shooting, then you can expect a lot of gunshot wounds. If you know it's a car accident, you can probably expect a concussion or something of that effect. So knowing and having an idea of what type of inventory you're going to need is kind of key, but I'm trying to figure out what a standard layout would be for you guys to carry on your person. Anyway, going from top to bottom because it's easiest, you have your basic bandage that's used to cover a wound. Now, a basic bandage will be used in conjunction with the elastic bandage, which is like an ACE wrap, to go over it. In our loadouts, I'm going to try to avoid these because they're generally useless when it comes to quickly treating a patient, and I don't think we want to be spending 15-20 minutes on one person bandaging up all their wounds. CMS currently grades wounding on a very simple scale. It's large, medium, and small. So when you examine a patient, you'll see they have a large open wound, they have a small open wound, or they have a medium open wound. Packing bandages are used to treat large open wounds. They will have, in the real world, if you have a large gaping open wound, you pack it with gauze and then you cover it with a wrap to keep the wound shut. So the bandages you put inside have the benefit of quickly clotting the blood for the triage team to deal with later, so it stops the bleeding, but has the added risk of a stroke if you have some type of aortic rupture, or I should say a vein or an artery rupture. But if you have a large wound in CMS, key thing that you need to use is a packing bandage. Tourniquet's kind of the same deal, except you can only apply a tourniquet on limbs, so arms and legs. If you've got somebody that's got a massive hole in their leg, I mean, I'm pretty sure we've all seen war movies. What's the first thing they do is they either rip off a belt or pull out a tourniquet and start clamping up their leg to help slow the flow of blood. Same principle here in CMS. If they've got an injury to their extremities on their limbs that's large enough, put a tourniquet on, then bandage. Once you're completed bandaging, take the tourniquet off and observe for signs of additional bleeding. Splints don't work at the moment. I don't know when they're going to be integrated. I've been stonewalled on that one. So there's no breaks at the moment. There's no bone structure system. So that could be a while out. Plasma blood saline, or saline. Plasma and blood are going to stay in vehicles or at base only. If you hover over blood, it will tell you why. It tells you to keep it cold. Both of these things have a very, very short life outside of refrigeration. In CMS, blood only lasts about 10 to 15 minutes in a backpack or outside of a case or a vehicle. Plasma lasts about an hour and a half to 2 hours, I believe, and saline is just salt water, so it lasts forever. What you're probably going to see is that in your normal carry bag, you'll have 1 or 2 bags of saline, and then the EMS vehicle should be equipped with some plasma. We'll leave blood for designated triage facilities. Did somebody have a question, or was that just an accidental hot mic?
That was just me.
What's the use of plasma then, exactly?
Plasma is, just as it describes, is a volume expanding blood supplement. Basically, your blood in your body right now has blood platelets, and it also it's suspended in plasma. So your blood is red because there's a shit ton of red blood cells inside of it. It's not because blood is different than plasma. Plasma is essentially the vehicle that carries your red blood cells around your body. In a pinch, plasma can last longer, and it also helps clotting because it contains a lot of essential clotting factors such as platelets and such. But we won't be using plasma. Or 9 times, unfortunately, the way with CMS works is it's very sensitive to the way you tweak the settings. So I've never really had to use plasma all that often, because if you have a person with massive blood loss, you bolus a bag of saline, and then by the time you get them back to base to give them a full heal kit, they should be fine. So that'll be outlined more in detail about its specific purpose in triage. But for practical purposes and for what we're going to do, we'll rarely, if ever, use blood, and plasma is kind of the same deal. So you guys will have saline, but I'll talk about that later. Well, saline is basically just salt water. If anybody has ever had surgery or whatnot, when they plug the IV in and they hang the clear bag, which looks like they're just hanging water, that's saline. So it helps. It doesn't necessarily help restore blood because only your bone marrow can do that, but it does increase the volume of blood that's back in your system after you've lost some, so that your heart doesn't have problems pumping it. Any questions thus far? Perfect. Morphine and epinephrine. If anybody has allergies, you know exactly what an EpiPen is. Morphine is rarely used in combat anymore. The preferred drug of choice is ketamine, but morphine is obviously a pain reducer. If somebody's in pain, they will see it on their screen around the border as white flashes. The faster the white flashes, the more pain they're in. Pain in CMS will increase your chances of passing out. So if you're in pain, there's a pretty damn good chance you're going to pass out from the shock. One thing to consider with morphine and epinephrine is the side effects. Morphine is essentially, at its basic form, a muscle relaxant. So if you have a patient with a heart rate is low, or who has a very low heart rate, it's not a great idea to give them morphine because you have a pretty good chance you're going to stop their heart. Epinephrine's the opposite. Epinephrine is used for allergic reactions typically, but it does increase the heart rate. So if you have somebody who has a low heart rate and it's still low, giving them an easy pen of epinephrine will jack their heart rate right back up to normal.
Just say if you mess up and you overdose the morphine or something, the way this works, you can just like counteract it with epinephrine, so
yeah,
that'd be okay.
Rule of thumb for morphine is give one. If they're still in pain, then don't give them another, because 2 morphines is a really good way to get something, or really good way to spiral the situation out of control. So 1 morphine per patient if they really, really need it. If they're able to, if you're able to get them in an ambulance or get them in a car and get them to a triage facility like a hospital or an aid station for a full heal, then just wait. Because morphine in CMS tends to cause a lot more problems than it solves. And I believe it was Steven was right, or Steve, that CMS works on a checks and balances system. So if you have a low heart rate because of morphine, give them epi and it'll fix it. Atropine we won't use because it's only used for nuclear, biological, and chemical scenarios. And you also saw when I gave it to myself, it has the added benefit of lowering the heart rate, which is not exactly true of the real world, but hey. We won't have atropine in our loadouts because in CMS it's pointless. It has no use at the moment. Basic field dressing. This is what you're going to have a lot of in your backpack. It has the words quick clot next to it. Now in the industry, if anybody's seen the World War II war films or any modern documentaries or whatnot, like the one that National Geographic did with the pararescue guys, the PJs in the Air Force, you see them putting, especially in World War II movies, they rip open a package and they put this like white crystalline substance on a wound. That's quick clot. It was a lot more primitive back in World War II, but it still performed the same function of allowing the blood to, or helping the blood clot quickly. Nowadays we have quick clot integrated into bandages, so all you have to do is put the bandage on and assist with the clotting. This is the best bandage to use in CMS. That in conjunction with the packing bandages works fantastic. Be wary, and I'll show this later, hopefully, if we can pull it off without actually just killing somebody and actually being able to bring them back up with a gunshot. Quick clot bandages are the most stable bandages to have on. If you have a basic bandage with a elastic bandage over it, those tend to rip open a lot faster than the quick clot ones do. One of my favorite things, I'm just going to hazard it. Can anybody actually pronounce that?
No.
Is
nasopharyngeal.
Nasopharyngeal in the industry is known as an NPA or a nose hose. So by the prefix, you can pretty much guess where it goes. It's an easy way to open a blocked airway if there's any sort of trauma to the mouth or the throat, or the person has their jaw locked shut for whatever reason. It's a secondary way of opening an airway and allowing oxygen to enter the lungs. You'll only use an NPA if a patient is unconscious and not breathing, or doesn't have, or is doesn't have a heart rate and is not breathing. So anytime you use that for resuscitation, it's obviously a one-use type of thing in the real world, but CMS is stupid in that when you pull it out, you get to use it again. So I don't think I want somebody's snotty plastic tube that I just shoved down someone else's nose to be thrown into somebody else, because that's just gross. But yeah, that's only used for resuscitation. Not really big deal with that one. Bandage, elastic, already went over that. Liquid skin does not work, as I said before, because burns are not really simulated well, and you can't even use it. I haven't figured out a way to use it yet. Chest seals are for sucking chest wounds. Typically seen with gunshots. It's when the bullet or you have a penetrative injury that also shoots through the lungs. What you will hear is a sucking sound, and you'll hear this when you approach the patient. It is really noticeable. If you've ever tried to suck the last bit of milkshake out of the bottom of the glass, that's exactly what it sounds like. Yeah. So you'll notice it. The chest seal helps close up that chest cavity and restore positive pressure to the lung chamber. Obviously not a permanent fix, because you need surgery for that, but at least for the moment it allows the patient to breathe easier. So if you come up to somebody, you hear that sucking, and you would examine them and it says having trouble breathing or labor breathing, and you hear that, just put a chest seal on and then put a Band-Aid over it. Personal aid kits, depending on how they integrate this, can and cannot be used in the field. I don't know what the devs decide to do. They haven't consulted me on it yet, so we'll just take it as it goes. There's a couple of different settings in CMS that you can use for this. They can either be a full heal, like back to 100%, no problems, just like they were walking 10 minutes ago, heal, or you can have it so that it's kind of like a, I kind of like to use the term warm blanket. Typically in the real world, when people get in the ambulance, they're usually at, obviously we see people at their worst when they've been shot or have a heart attack or what have you. The second we put a warm blanket on them, everything starts to just calm down and they start to just decompress and just really mellow out. So the personal aid kit on the second setting in the field, I like to call it the warm blanket setting, is that it gets them stable enough that their wounds won't reopen, but they are not at a full heal yet. So you can have it so the only way the personal aid kit is effective is when you use it at an aid station or a designated treatment facility. And there's one more setting which it just doesn't work in the field at all, but I doubt they'll use that. So, any question about the objects that I've covered so far? Okay, fantastic. If you guys want to grab some different bandages, tourniquets, if you want to grab some saline, that's fine. Maybe a morphine and an epinephrine. We'll start shooting up dummies and showing you guys what it looks like when they start to get healed. Alright, let's grab a guy front and center here.
Actually, before we do move on, in regards to the saline drips and stuff like that, is there a difference in the amount? Like, is that meaningful for us?
We don't have the ability to regulate the drips of saline or the saline flow rate. Basically, they come in 250, 500, and 1,000 milliliter bags. So depending on the type of blood loss, you'd either bolus a liter bag or you just bolus a tiny 250 milliliter bag. But we don't have the ability to control flow rate. Once you administer them, it's like putting it on a bandage. So you can literally, it's goofy that way, which I think is stupid, but you can literally bolus a whole bag of, or a whole liter of saline in 5 seconds, which in the real world is not possible.
Yeah.
But
let me rephrase it. You know, I worded it pretty poorly. What sort of situations do we use the different sizes, I should say?
If you see somebody is suffering from extreme blood loss, I'd probably use a 500 to get. Basically, it's kind of, I kind of only use them in CMS as like a doomsday scenario. In that, if I've done all the treatment I can. I've stopped the bleeding, and I'm still having problems with the patient's blood pressure, I'll give them a bag of saline, so I pump back up the amount of fluids they have in their system, and that usually normalizes their heart rate and their BP.
Okay,
but
thanks.
the CMS is twitchy in that you either have a really fatal injury that's hard to come back from, or you have a really basic injury that's simple to treat. There's hardly any middle ground, which is goofy, but who knows? With an integration on this type of scale, we might see all sorts of different things. I just know it from a milsim aspect in that 9 times out of 10, if a person receives a gunshot, they're in pretty bad shape. Alright, so this poor bastard here in the middle of us is about to get shot. And he's going to get shot a lot because I just want you guys to be able to see what happens when you treat somebody so. He's definitely very dead, and he's not coming back from that. So, gather around and interact with him medically. If you all can't reach him, then... Actually, I can't bring up a menu on him. Can you guys?
Okay.
That's a lot of medics for one dude.
Yeah, it's probably too many medic consoles open. Okay, you can see he probably has a lot of wounds. Let's see if I can get in here.
Just bring him and I can group to tree or something.
Okay. I can see him now as I stand on top of him. Oh yeah, that's a good idea, Pete. I'll just shoot somebody else. I'll just shoot a couple people and you all can... Where'd the other fuckers go?
Oh, you shot and they'll run away, yeah.
Oh, that makes sense. I'll spawn a couple more.
There we go.
We're cooking with gas now. Alright, here's 2 more. Tough shit, boys. Alright, so you see they got a bunch of wounds. They're all going to be pretty consistent. They're all gunshots. If... ... Okay, I can't open that guy's one anymore, so I'll have to try on somebody else. Alright, so, for example, my guy has a couple of large wounds on his head, a couple of medium wounds on his chest, 3 medium wounds on his arm, and a large wound on his leg. For a large wound on a leg or an arm, first procedure, point of procedure that I would use would be to put a tourniquet on. So if you go over to the bandages and fractures button, which is the 3rd from the left, you'll see the tourniquet. And once you apply it in the overview, you'll see on the right hand side that a tourniquet or cat has been applied. Now, like I said before, you can't leave them on because otherwise they'll injure the person further. So once you stop the bleeding, then you're able to remove it. So I've got some packing bandages. I'm just going to bandage up a guy's leg. You're more than welcome to treat wounds to see how they work. Once an area is no longer affected by bleeding or what have you, it goes from dark red to light red, or it's almost indistinguishable. It almost goes back to gray. The more red it is, the higher chance of recurrent bleeding or open wounds there are. Now, sometimes you will see a patient who has completely white everywhere, but when you click on body parts, they see they have wounds. It's a glitch. Just anytime you examine a patient, check every single one of his body parts, and you should be pretty okay. If you have somebody that has, this you'll see typical in car crashes. If you have somebody that says, I'm in pain and I can hear my heart rate, but you examine them and you find no wounds whatsoever, that usually means they have a concussion. And all you have to do is bring them back to an aid station or wait for that to resolve itself. Once you bandage up all the wounds, you can administer different medication as you see fit. Because these AI are extremely hard to revive, it's kind of pointless to try and do CPR and revive them at this point, because I guarantee you they won't come back.
How do we sit?
I'm sorry?
How do we sit? Because I can't get up.
See what?
Like,
Quotation
no,
marks.
sit.
Just next to the enter key.
Oh, thanks, guys.
Yeah.
Sorry about that.
As far as the CPR is concerned, that's under the Advanced Treatment tab. You just click it to perform it, and once you start performing it, you just click the same button. It'll say Stop CPR. Different... Let's see, what else can I think? Yeah, as you can see, at least from the guy that I'm looking at, I'm assuming that other people that are looking at the same thing, as you bandage them and they don't have wounds, you'll see that the wounds that they had are now listed as bandaged, but the body still remains pink. See you, Pete. I might do another one tomorrow, I'm not sure. I'll think about it. Did I pick up... Oh, I didn't set... I should have set this area as an advanced treatment area, but oh well. Once you give them a first aid kit, they should be back to normal, but obviously if they're dead, so... any questions about operating with the certain medical equipment, how CMS works? Because if not, I was just going to spawn a bunch of guys and drop a box with weapons and allow you guys to shoot them up and treat them.
Can we
Yeah,
do like
I'd like you to do that. The more practice, the better. If everybody could get like one guy to themselves, if that's possible.
Yeah, that's,
2 people per person would be more
yeah,
realistic.
can we also do something like when somebody does something like a cardiac arrest or something, that we can see how to revive him properly? Because when someone was shot, I tried to CPR and everything, get him back to life, but it didn't work because he was dead. Like,
the problem with the revives is it's very touchy, in that I've only found that I can make it work on players. I've never made it work on AI, and I've only made it work on players twice. If they're in a cardiac arrest, the basic principle of trauma casualty care is bleeding, breathing, and shock. So check for bleeding, or stop the bleeding, check for breathing, and check for signs of shock. Shock won't present itself in CMS because obviously you can't read a person's face because they're always the same fucking expression all the time. But in order to perform effective CPR, if they're bleeding, you need to stop the bleeding before you start giving them CPR. Otherwise, you're going to just start pushing blood back outside of them. I mean, I can try to shoot one of you guys, and we can try to bring you back up. There's respawn, so if
yeah,
you die, but...
You can shoot me.
Alright, let me get some medical supplies first before I do this.
I'm the dude with the hipster glasses.
Another thing I wish we had in this
go
game,
ahead.
or I shouldn't say in this game, in CMS is adrenaline. Adrenaline is used when you have a situation where you need to revive somebody. It gives a shot of adrenaline to the heart, and then allows for easier resuscitation. But epinephrine in CMS can substitute for that. Alright, who is I going to shoot?
You can shoot me if you want to band you.
Twixter. Alright,
Yeah.
everybody, or let's see if we can't do this.
Can you move away from the guy already on the ground?
You can
Yeah.
shoot. You can shoot me because they need to learn how to do it. So. Right, good job. You shoot Steve.
Alright, I'm just going to dome Steve. So, this is the guy I'm walking around. So you just get a shot to the chest. Oh, my goodness, he's dead. What a tragedy. Look at the medical. Okay, so he's got a large wound on his chest. You died immediately?
Yeah, I just respawned.
Oh, for fuck's sake. Okay, see, that's the problem with CMS is if you're too wounded, then you just are automatically killed. So,
And it's going to be like that in the game.
no, there's settings you can change to prevent that. So you set like a period of, like, if you have, for example, no heart rate, there's a period of like 15-20 minutes where you can be revived.
If you shoot me
yeah.
once in the leg, then and I don't die, then that'll just be like a bandaging tutorial, pretty much.
Yeah. All right. Let's do that then. So now he's been shot in the leg and he's out cold. Let's see. First thing to do is check pulse and blood pressure. So, checking pulse, he's got no heart rate, which means he's not going to have any blood pressure. So, first order of business, bandage up the wound. He's got a large, and a medium. While you guys are bandaging, I'm going to put in an NPA. So now he has a nose hose
I'm
in.
back. Kind of. Not really.
Did you
Not
respawn or?
No. I'm not passed out anymore. I can get up.
Yeah.
I think you helped the wrong guy. I think.
Did I?
No, you
Yeah.
helped me. I'm fine. No.
No, I helped you. I gave you.
Everyone was
Oh,
helping
that's your
me.
other body. Whoops.
Oh. Well, someone saved me anyway. Congratulations.
Oh, Connor,
I think
Jack
it was Connor and Jack. Yeah.
Uh-huh.
But yeah, if you bandage
Well,
somebody, sometimes they'll just spring right back to life, which is hilarious. Other times, if their damage is severe enough, then you'll need epinephrine to bring them back. So they'll just be passed out, and epi will revive them. Or you can just, sometimes they'll just slowly come back to consciousness. I don't know. It depends. You just have to monitor vitals. CMS is goofy in that the only real way to teach people how to use it is to actually put them in, I shouldn't say real world situations, but actual situations, not training scenarios, because that's when you really get the flavor of what CMS does.
The thing is, if someone gets run over, they're pretty much fucked.
Yeah, right now the vehicle damage and object damage is pretty broken. If you get in a vehicle crash, you have a 50-50 shot of either getting instantly killed or having no damage whatsoever. Did Jack just pass out? Oh no, that's a dead body. Somebody was fucking with a dead body.
Dragon
So
and Karen
they
is
should be
right now.
have that fixed on Sunday. All the vehicle collisions. I'm gonna actually try and carry this guy with a weapon to see if you guys were right about that, or did somebody just pick him up? Somebody else just picked him up. Okay, apparently I can't drag him. Can't interact with him.
Oh, I died.
What the fuck?
What?
Helicopter
fuck?
exploded. Helicopter exploded.
Oh my god.
There's training for you, lads.
Oh,
Save them all.
Oh, what the hell?
Hey,
I'm
where's
going
the-
to the fire.
are people not respawn? No, everybody's respawning. Look at all the dead bodies.
What the heck?
Whoa,
someone needs
somebody's
to
really
respawn.
fucked up, man.
I'm not respawning.
This man by me needs to be
who's
helped.
me?
Dan Summers.
Here, over here by
Stay
me.
right
This
next to
man's
where
passed
you were.
out. Help him.
I can't
Yep,
pick
I see
anything
you.
up.
Okay, everybody look at Dan Summers before he dies. Really, I'm staring at him.
I'm
He's
out,
got
and
difficulty
I died.
breathing.
Everyone's frozen.
Everyone's just standing still for me.
Yeah,
Yeah.
same.
Oh, really?
I can't pick
Yep.
anything up
Just
either.
respawn and then everyone won't be standing still. Wait, let me guess when you...
Everyone's just standing.
Don't let me die like this.
You just
Being a
magic up a
smartass.
respawn. What the fuck?
Everybody else respawned except for me. I'm the only one
I
who
don't think the
sort of
helicopter...
lived.
Don't never use the helicopter.
Okay.
This is my life now.
I'm just gonna restart this.
Yeah.
Exactly. There was an
I
explosion
don't know
in
why
the
that blew up.
helicopter.
That
Everybody
was
died
weird.
except for me.
Oh, I died from the
Kill
burning
myself again.
thing.
Never restart
Yeah,
it
if you
now.
walk next to it, it doesn't end very well.
Still 5 meters between the...
Oh, that was funny though.
Oh
that
god, the
lived.
ping.
Yeah, I'm sorry, but when you're hosting it on a personal computer with crappy internet, that's what's gonna happen. But at least it's worked so far, eh?
That wouldn't be bad at all.
Yay, we're all
Can
live
you,
again. So
Can you spawn in a vehicle or something and just try to see what happens if there's a light crash or something?